Good morning to everyone. Can you hear me?
Yes, sir, audible.
Good, audible. Good. Welcome to our second Global Ayurveda Doctors Day on October 3rd, 2024. Last year, we performed the first Global Ayurveda Doctors Day. This is the day we are celebrated on the behalf of this AAPNA, Association of Ayurveda Professionals of North America. And our goal is that our Ayurvedic doctors globally spread out various countries and spreading the knowledge of Ayurveda, empowering and educating the various integrative Ayurvedic professionals, health professionals, as well as yoga teachers and wellness coaches, and establish their practices and establish their businesses around the globe. We have put them together. That's this Ayush trained Ayurvedic doctors, particularly BAMS, MD Ayurveda, MS Ayurveda, PhD Ayurveda. These are the various trained Ayurvedic doctors migrating to the various parts of the world and spreading the knowledge by incorporating the other allied health sciences like naturopathy, acupuncture, nursing schools, physical therapy, other courses they have taken, and they are integrating the Ayurveda into their day-to-day practice because of legalities. Various countries, Ayurveda is not recognized as an independent Ayurvedic profession, as an Ayurvedic medical profession. And various countries such as Saudi and South Africa, Saudi Arabia, and various countries, Dubai, Ayurveda is recognized as alternative healthcare system. In India, in USA and Canada, not yet recognized as alternative system of medicine, but still Ayurveda practitioners are incorporating, Ayurveda doctors are incorporating Ayurveda into their day-to-day practice and successfully practicing. Now, every country having organizations are there, and national organizations, international organizations, they are working towards getting the Ayurveda a licensed profession, but it takes a long way to go. Like Ayurveda takes a long time to go, like a medical system, chiropractic and naturopathy degrees and osteopathy, various doctors, they try to stride into the various levels of training programs. For that, the government of India, Ayush Ministry, as well as World Health Organization has established a benchmark training in Ayurveda, which is established very well. And we are slowly incorporating those principles also worldwide. We have to establish a standard Ayurvedic education, standard medical profession ethics and guidelines are required for establishment of the wonderful practice of Ayurveda. Then empowering, this is the thing, what we are trying to do here. We wanted to have empower these Ayurvedic doctors who are there practicing and giving a moral support, a boost for them. This is the reason we are doing this one. And we have 3 keynote speakers in today's presentation. And after that, we have an open for all the speakers who are registered and other participants who can speak about a few minutes about that. This session will go for 1 hour. First of all, I would like to invite Dr. Prasanna Savanur, who is a PhD in Ayurveda Dravyaguna specialist, and he is a dean and principal of the Ayurvedic College. And Dr. Prasanna Savanur, please join with us and unmute yourself.
Yes, sir. Am I audible, sir?
Yes, sir.
So good afternoon from here and good morning to all of you, those who are there, the online. Today is celebrating second Global Ayurveda Day. Warm greetings to everyone on the eve of this Global Ayurveda Day. Today's as we reflect on this rich legacy of Ayurveda, it is vital to recognize the pivotal role of Ayurveda doctors play in global healthcare. As our Dr. Shekhar Annambotla sir is doing, it's really appreciable since more than a decade there. So empowering them is key to bridging the gap between traditional wisdom and modern medical practices. This integration is most important in this aspect. First and foremost, that we must focus on the knowledge of integration. That is, this traditional and this modern medical practice integration is very essential in nowadays. Ayurveda doctors, they are not just custodians of ancient science, because we behave like custodians of this, but they are pioneers in integrating holistic care with the contemporary medicine also, by equipping them with the deeper knowledge of pharmacology, biochemistry, and modern diagnostics. We should be able to elevate their ability to offer the comprehensive care, integrating the digital tools. Nowadays, the digitalization has become a more important tool, and everybody is looking towards the digital tools also. And this integrating these digital tools and research platforms enhances the clinical precision and making Ayurveda more accessible and more evidence-based, which is most important, what I think. And secondly, this hands-on training and clinical exposure are very essential, which in the practice of this Ayurveda, as it is a practical science. This Ayurveda itself is a practical science, and our doctors need immersive experiences from herbal gardens to the modern laboratories. Not only visiting for the herbal garden or something, we should even go to the modern laboratories. This makes empowering them to understand the real world application of classical Ayurvedic principles, especially in areas like pharmacovigilance, nutraceuticals, cosmeceuticals, and all these things. And these things have been incorporated in the competency-based curriculum in India now. So which is almost all empowering the students also. And third most, the policy and regulation regarding relation support is most crucial. Doctors need more clarity on this global and national regulations regarding Ayurveda, Siddha, Unani drugs, their patents, entrepreneurship opportunities, etc. This knowledge empowers them to not just practice, but innovate and lead the both local and international market. I think this is most important, and under the leadership of Dr. Shekhar Annabotla sir, it is under the progress also. It's nicely turning up to this one. So as the time has been given for me to conclude, because I don't want to pull on more things on this one. With these points, finally, I want to say that this empower comes through community engagement. Ayurveda is for everyone, not for any individual. It's for everyone. And empowering our doctor means giving them a platform to spread this knowledge and to communities worldwide, which Dr. Shekhar Annambotla sir is doing since long period, and it is giving fruits also to him. Whether through consultation, research, or teaching, they must be enabled to act as an ambassadors of holistic health, not only in India and throughout the global things. So as we step forward, we can take a pledge to continue nurturing the Ayurveda tradition by empowering those as its heart, our doctors, so that they may heal, teach, and inspire a healthier world. And once again, I wish everyone happy Global Ayurveda Day. Dhanyavad. Thank you.
Thank you, Dr. Prasanna Savanur sir, for giving insights of things and also empowering of Ayurvedic doctors and how they not only in the Shastric knowledge of Charaka Vagbhata knowledge and everything, slokas and everything, in addition to that, how they can integrate other systems of medicines and everything. For that, we have a pioneer expert, and Sushruta is the one who explained that not only studying of Ayurveda, other systems of medicines also required to study, then only the clinically and research-oriented and well-versed physician can become. And for that, Dr. Srinivas Gujrawar, sir, Srinivas Gujrawar, sir, can you unmute? Yeah, Srinivas Gujrawar, he is a classically trained Ayurvedic doctor, and also he's a surgeon. And he will be discussing about that how we can integrate the Ayurveda and other systems of medicine together and empowering of Ayurveda doctors globally. This is our Ayurveda Doctors Day. This is especially we are created in a special Ayurveda Doctors Day. This Ayurveda doctors are not inferior to the other medical systems of doctors. They are powerful. They are also well trained, well qualified, institutionally qualified, and legitimately they are practicing around the globe. For that, Dr. Srinivas Gujrawar is going to discuss. He's a keynote speaker for today's session. Welcome.
Namaskar, namaste to all. First of all, thanks to Dr. Shekhar Annabotla ji for giving me this opportunity to speak here, and I congratulate to him on his birthday. Today is his birthday, and on that day, this Ayurveda Doctors Day is celebrating around the globe as a global Ayurveda Day.
Sir, happy birthday once again from my side
thank
also.
Thank you. Thank you.
So Ayurveda is the science of life. Everybody knows this is the since last more than 5,000 years practicing in India and around the globe as a traditional medicine. Now this science is taken around the globe. Dr. Annabotla ji is the really ambassador. He is taken from India from Andhra Pradesh to Jamnagar, from Jamnagar to America, and he's practicing, giving training to everybody around the globe. Always he's busy. This science is not only the traditional medicine. This science is a real science, and scientific way he's teaching every day. 24 hours he's teaching. I am seeing him always he's busy. This BAMS, MD, PhD, and there are a lot of certificate, diploma courses nowadays is developed. We feel proud that India is the World Ayurveda World Health Organization is declared India as a traditional medicine center for so, and this science not only massage. The first people were thinking Ayurveda is massage course, massage science or jadi butti like herbal science. This is not only herbal. This science is having Ashtanga Ayurveda, Kaya Bal Graha Shalya Damshra Jara Vrashay Urdhvang. These all 8 branches are there. This is when we are going to study or going to treat the patient. Not only with Ayurveda, we have to study all other pathies, allopathy, yeah, and homeopathy, Unani, whatever is there. We are going to treat the patient, not only the science, treating the science. So that's why, and now everywhere, many academies they have started around the globe. Dr. Suresh Swarnapuri ji is there, one of my friend, Dr. Gaurang Joshi ji, he's spreading uh, Ayurveda everywhere. California College of Ayurveda is there in US, and Texas there is another college, and many people are now. So lot of scope is there in India. More than 600 Ayurveda colleges are there. In Haryana, we have Sri Krishna Government Ayurveda College, and it is now converted as Ayush University. Uttarakhand is there is a Ayush University, is the Ayurveda University. Rajasthan Ayurveda University. One more new Ayurveda college is started. In Maharashtra also declared Ayurveda Ayush University. So Gorakhpur there is a Ayurveda University there. BHU is there. Jamnagar Ayurveda University there, and uh, in Rajasthan also NIA is become Ayurveda University. So now this science is not only traditional science. Now this is the legal science, legal, and we want to make this first science of health science globally. So um, I have a small space to speak here. That's why I'll conclude my talk, and I'll give the best wishes to all speakers. And again, I'll give the best wishes to my respected Dr. Anna Botlaji, Shekharji, for his on his birthday, and happy Ayurveda Doctors Day to all. Namaste. Thank you very much.
Thank you. Thank you very much, Dr. Srinivas Gujarwar, sir, for giving an insights of the things and what is going on in India. And as we see more and more spreading of Ayurveda, people are thirst for the Ayurveda knowledge around the globe. And every look and corner, we have a lot of Ayurveda practitioners are spreading in these things. The question coming here, Ayush trained Ayurvedic doctor, how they can migrate to the various parts of the world and spread the knowledge of Ayurveda. First of all, there is not necessary that everybody has to go to the various countries. You can start your own Zoom meetings and they spread the knowledge. That is much. The COVID has given a blessing for us to reach out to the worldwide, almost all countries. Like we are need to be, Ayurveda doctors will be like a virus. So that means we'll need to be, a virus does not need any platform. You need to spread the word. If you wanted to travel to one country to other country, it's very difficult. Like, for example, you need to go to the Ireland. Dr. Robert is here, Ireland, and you need to go to the Ireland. It's very difficult to travel. And Iceland, all the various countries, whereas Zoom connection is very easy. Now, today, we have almost 130 people are there. People always thinking about in India, a lot of doctors, Ayurveda doctors, think about that, oh, how can I come to the other country? I don't have finances. I don't have funding. But the Zoom meeting, you pay $144 per year. You can have as many as lectures you can do it. So every person, every individual Ayurvedic doctor to be empowered and learn the knowledge more simplified and communicable way to communicate very well to the people and educate the people as many as people. And Ayurveda is not only doing of one part like the Ayurveda integrating yoga. How Ayurveda and yoga are integrated. Ayurveda and pranic healing, Ayurveda and Reiki healing, Ayurveda and energy healing. All the various things can be combined together. Like in the hospitals, you have a dermatologist is there, anesthetist is there, and lab technician is there. All the people are there. So this is the way that they combine together. Similar way, we need to have research oriented. Documentation is very important. Now, traditional system of medicine is completely gone. Tradition has gone because tradition means father is teaching to the student, student is the son is teaching to the next. Gurukula model is there once upon a time. That is the reason when the Gurukula setup is there, then we call it a traditional medicine. Now, the Ayush Ministry has declared as an evidence-based medicine. Evidence-based medicine. Remember, these words are very important for us. Evidence-based medicine. Even if you are talking about Hingvastaka Churna, how the Hingvastaka Churna is how it is balances the Vata dosha, Apana Vata level, and what is happening there. Even your gut flora and what changes are happening. Hingvastaka Churna, simple tablet, how it is helping that gut flora and everything, gut biome, how the gut biome is changing. This is the way we need to look into that. For that, Ayurveda doctors should know about what is gut biome and what is the gut flora and digestive system and everything he has to understand. And then he has to explain, able to explain to the Western medical trained doctors, then how the biome is changed in the body. That is the thing, microbiota and biome, how did it change? That is the way we are incorporating like that, because Ayurvedic doctors need to study Western system of medicine also to apply that knowledge and explain the knowledge to the other people. If you are saying that, oh, vata qualities are tatta ruksho lagu sita karas sushma chalo anilaha. That's it. You are chanting of slokas like that. It's no use. You have to clearly explain how it is the ruksha guna, the lagu guna, tikshna guna, all the qualities, how they are affecting on these things. Now, I request Dr. Gopid Raja Reddy. He is the director and medical director of the Aradhana Ayurveda Wellness Center. He has established a beautiful center in outskirts of the Hyderabad, and the Aradhana Wellness and Research Center. We have visited the center and we have created an MOU with them. Dr. Raja Reddy, who is a MD Ayurveda from Gujarat Ayurveda University, is being an NGO, he's not looking for the government job. He got a government job. He declared that he denied for that medical officer like that. He wanted to establish as an independent practitioner and establish a beautiful facility where he has visited various centers in the Kerala and other places of the countries like that, various parts of the places. Then he mimicked that way and established a beautiful center in the Aradhana Ayurveda Wellness Center. If you go into the Aradhana Ayurveda Wellness Center in the website, you can see these things. January, we are visiting this place with the Ayurvedic practitioners and Ayurvedic patients who are interested to receive the Panchakarma therapies. We are going there. We are welcoming Dr. Gopid Raja Reddy. He integrates Ayurveda and Western medicine and all the laboratory tests and everything do, how this Ayurveda doctors can be empowered with his wisdom and how he is able to establish his practice. This is the thing what we are trying to do here. We are people who are there, Ayurveda doctors, they are feel that inferior to themselves. We have to empower them, make them to stronger. That's our goal. Dr. Gopid Raja Reddy, please join with us.
Namaste. Namaste to everyone. Special thanks to and birthday wishes to Shekhar Anna. Just now I came to know your birthday today. It is I wish all on this International Ayurveda Day. Myself, Dr. Raja Reddy, as Anna briefed everything about me and our center. So I almost 25 years ago, I completed my post-graduation from Jamnagar, Gujarat Ayurveda University. Since 25 years, I am practicing Bainsa. This is a small town in Telangana, near to Hyderabad. So since beginning, I was in a moved to establish such a center in my native place, not near to Hyderabad, so outskirts of Hyderabad. So with that, the journey in practice started. With the grace of God and all, the things happen in a positive way. So last 5 years ago, in the COVID pandemic, we started the center. So this is now established in India, also one of the best center, especially Telangana, Maharashtra, and Andhra Pradesh. The 3 states, one of the best center, and globally also accepted. I've seen so many patients from different countries, especially US and European countries also. With the span of short period, we established center in a good way. So in that, basically the theme behind the establishment of this Aradhana Ayurveda, I will explain, and how in the 4-5 years the center is reached to globally. So in short few minutes I will explain, Anna. So regarding Ayurveda and everything, everyone knows. So so that the people will know, as Shekhar Anna said, this is basically the focus was that aim of Ayurveda, we all know that processes Asarakshanam, Aturasya Vikarasya. Taking that concept, we established this center. So in present era, everyone needs the mental peace, physical, mental, and social peace they are required. So in that way, we focus on 3 parts. Our infrastructure is class 1. You can say globally, even foreign patients also, they are appreciating about our infrastructure. Second, service related. And third is result, the treatment. In 3 ways we have taken. So infrastructure, almost 10 hectares we have developed, full of the resort ambience is there. In service sector, we focus so many things in the treatment part, the food related restaurant and housekeeping and yoga related allied services. And third one, we focus economical quality treatment, result oriented treatment. In that we are focusing twice a treatment, morning one session and evening one session. So with less cost and less duration of course, patients are getting good results. So in that way, and with the span of short period, 5 years, the center is running well with full of IPD and OP patients also good. So recently, as Shekhar Anna said, January with 6 countries, we have got MOU with the help of Shekhar Anna. That is also going on. So lastly, there is nothing more to add. Everyone knows. So if we do anything with a clear and pure intention, so God will support you. So the center is also like that only. The positive vibes are so there. Anyone who enters in our center, they feel that positive vibes. Shekhar Anna has also told me the same thing. So like that, and if your vision is there, you want to do something, and your intention and is clear, and with pure mind you are doing, so definitely the God will be with you, and you will get the success. So with that, once again I give special thanks to Shekhar Anna for this giving this opportunity to share on this platform. Also, I wish all of the joint doctors for special International Ayurveda Day. And lastly, I invite you, all of you, to once you visit, whenever you are in Telangana or nearby Nanded or Maharashtra, please visit our center. This is since heart and brain, we created this. So that's why you see and visit and bless us. Thank you, one and all.
Thank you, Dr. Raja Reddy, for giving how as an NGO, not a government, everybody is looking for BIMS, MD Ayurveda, MS Ayurveda. Sir, when I will get a job, when I will get when I will go into the government sector like that. Once you are into the government sector, you are looking for the promotion of your profession like that. First lecturer and associate professor, and if you are teaching profession, like that, assistant professor, then professor and dean of the university, like that, you are over a period of 40 years of experience, you finally end up with a dean position and some position like that. Whereas then medical officers and everything, the Ayush ministry, I am medical officers, they joined that. But as an independent and NGO, as establishing an Ayurveda wellness center, and along with that, Panchakarma staff members and cooks and cafeteria and all the different things, establishment like that, and all the therapies are there, inviting the people. This is the challenging day-to-day challenge. Whether you are making money or not, you have to pay all the employees and the doctors, and everybody has to pay. That the payroll and everything has to be taken care. This is a big responsibility. So when you take a challenge to work on that, people will become successful. That is the reason I always tell the people that you are not necessary to go to the abroad and practice like that. You can practice in India also successfully, establish your practice. You need to have a first initially 10 lakh rupees, slowly 10 lakhs to 1 crore, 1 crore to 10 crores, 10 crores to 100 crores. Like that establishment of the slowly building of your practice and everything. That's the way you have to establish and connect with the people. For that, you need to regularly doing Ayurveda doctors, because why we are doing this today especially is that Global Ayurveda Doctors Day, empowering of Ayurveda doctors. We are not here to teach Vata, Pitta, Kapha to the Ayurveda doctors. What we are trying to do, how successfully we are practicing individual practitioner, how, hey, there is a hope is there for every individual. We can be successful and to practice more. And like a modern medical doctors, hospitals, they are working and becoming a surgeons and everything. They take a challenging cases and everything. Apollo Hospital, Dr. Reddy's Hospital, so many hospitals are there. Similar way, in allopathic hospitals, like in Western countries also established various centers. Now, with due respect, I would like to, what I will do, I will take all the featured speakers who are there here, and one by one, I will take them there in the series. Now, Dr. Robert Thurston from Ireland. So only the person's name, I announce them, doctor's name, that person will be unmuted, then they can speak. That way, the speaker who is speaking, our goal is that how, if practicing and how to incorporate and empower them, empower the Ayurveda doctors. That's the thing is very, very important here. It's not like that we are giving a lectures or something like that. We are not educating the people here. What we are trying to do it here in the nutshell, empowering, like going to the meeting. What we are doing, we are going to empowering and meeting with them, hug together each other and knowing about that and showing our challenges and what challenges we are facing and everything, how to successful practice like that. Dr. Robert Thurston from Ireland.
Blessings, young sir. Blessings. Thank you very much.
Thank you.
Yeah, we run clinics in India. We have 12 female BAMS doctors, and the famous Dr. Nitin, who developed the Ayascan, the world's first software that can completely challenge allopathic medicine in terms of Prakriti. It's never been done before, and we're getting so much benefit. Instead of answering 20 questions for Prakriti, we ask 150.
Very good.
And we can actually use it. We're as good as allopathic medicine for diagnosis. And then we do the first world Vedic magnesium. I spent 7 years translating Patanjali Yoga Sutras, and I found things in there that had never been translated before. And I use these to develop a Vedic magnesium.
Very good.
Jumps into your bloodstream, hits all the energy points and gives you an energy boost within 3 minutes. It's amazing. It's amazing. And we're starting to treat patients all over the world, starting with magnesium. But we tend not to say, Ayurveda is some adjunct thing you add on because you're ill. Ayurveda is a way of life, and you should live it, not add it on because you're ill. And most of our patients, they're astounded when we talk, this is how you're going to eat, this is how you can do this. But it's really fun, and we're enticing more doctors to get involved with us so we can have joint ventures around the world. My ultimate And we tried some really top investors. We said we would like to build an Ayurvedic university hospital that used Ayurveda from all our doctors. Let's pool our knowledge. Let's put it forward there rather than doing it individually. I mean, I don't do this to earn money. I mean, as long as I have food and a place to sleep, I am a happy man.
Thank you.
And we want to bless you, sir, for all you have done in bringing Ayurvedic doctors together worldwide. It's so amazing, sir. So amazing.
Thank you, Dr. Thurston, for giving the opportunity and then also spreading not only that, because inventions, new inventions are developing like that now, Prakriti assessment and everything, Vikruti assessments and all these things, diagnostic tools are developing like the modern medicine having a blood pressure, EKG, ECG and all the instruments are there, still there, but we are developing from our side also, we are developing where these things are there. That's very important. Now, Professor Dr. Ratanpal Singh Chauhan, few words about the empowering of Ayurveda doctors. Unmute yourself.
Hello.
Yeah.
Hello.
Yeah.
आप सुन रहे हैं मुझे?
Yeah.
Thank you very much.
Yeah.
Shortly you have called me. I am very happy to know this. Today I was on the some other city. Just I come and attend to you. Regarding the Ayurveda, I have conducted one animal research work वृद्धाहार के ऊपर, और उसके मुझे बहुत अच्छे रिजल्ट्स मिले थे, और मेरे को ये लगा कि आयुर्वेद का जो जितना भी चरक इत्यादि में जो करके लिखा हुआ है वो ऑटोमेटिकली कंप्लीटली रिसर्च मैटर है, रिसर्च नहीं सर्च मैटर है, बल्कि अपन उसको रिसर्च करके उसको डिनाई करते हैं. दिस इज अवर ग्रेट फॉल्ट. सेकंड, I have gone through the painless tooth extraction also during my NIA service job. So, Doctor, shortly I have also accredited with the USA Nutrition Association also.
Very good.
Shortly, I am not able to understand what I have to say to you, but thanks to you that you are asking me to say something.
Thank you.
Okay, thanks.
Thank you, Ratanpal ji. Thank you. And Dr. Rajan Patankar, Vaidya Rajan Patankar ji, few words.
Yes, first of all, healthy and happy birthday wishes to you. Second thing, by listening all the stalwarts, want to say something, कि we must know the strength and weakness of each science. If it's Ayurveda or allopathy or any science, the strength and weakness should be studied properly. Second thing, as told by all the speakers, integration means, in my opinion, if you are available with all the new techniques of allopathy, go for them, because to diagnose it by doing some pathological test or doing MRI or anything, you can exactly your diagnosis of Ayurveda. You can exactify. So that's my opinion. So new tools should be considered and should be applied and should be taken. But integration means not to integrate everything, but the thought should be of Ayurveda and the treatment should be given as per Ayurveda by using these new techniques. That's my opinion. Then last and most important thing, as told by Annam Botlaji also, evidence and documentation is nowadays need of the hour. And as told by all of you, to practice in everywhere in the world is not possible nowadays, because the restrictions and the laws of different countries should be studied. So, as Annam Botlaji told, you can practice from where are you and where you are staying. So nowadays, international platform through Zoom is available. So you can consult or you can direct your patients from there also. Thank you very much. These are my few words for you. Thank you.
Thank you, Rajanji. And Dr. Kella N.V. Sai Shankar Prabhu.
Yes, sir.
Yeah, you can speak. Few words.
Sir, good afternoon, sir. Sir, good morning, sir. I am from India.
Yeah.
Sir, would like to once again happy International Ayurvedic Doctors and moreover happy birthday to you, sir. I would like to add a few things about the Ayurvedic. Sir, Ayurvedic is a basic term and it's already proved that science. And we have, as you told us, Vata, Pitta, Vata and other medicines is there. And moreover, the herbal sciences is greater than allopathy and other medicines. We already proven that like Siddha, Unani and Yoga to the international. So as you said that we are not going to practice anywhere, but the greatness of the Ayurvedic science already proven to the world. It already reached to the world by Siddha and other theories. So, as my request is to that, so by getting the medicines and treating also that, so we used to concentrate on the adulterations, which used to prevent to get sufficient good medicine to practice in Ayurvedic also is very needed, and for my opinion,
Thank you. Thank you.
adulterations will control means good property of medicines will come and we'll use then we'll prevent to other countries to that is such as good medicine from our Ayurvedic medicines.
Thank you. Thank you, Sai Prabhu. Next, our
Yes.
Dr. Om Prakash. Dr. Om Prakash, you are there? Om Prakash. If not, next is Dr. Buddhi Prasad Paudal. Dr. Buddhi Prasad from Nepal.
नमस्ते सर।
Namaste.
आपको जन्मदिन के अवसर पर हितायु सुखायु और दीर्घायु को शुभकामना। नमस्ते टू ऑल। Happy second Global Ayurveda Doctors Day. Today in this forum I would like to say that Ayurveda that स्वस्थ से स्वस्थ रक्षणम उद्देश्य of Ayurveda, first उद्देश्य of Ayurveda is very important, and I am working as a Ayurveda lifestyle coaching expert in our country, and the Ayurveda lifestyles, the non-communicable disease globally 74 total 74% of population is suffering from NCD, and if we aware people with Ayurveda lifestyle, we can prevent and reverse the disease. When we meet the patient in that borderline area of those diseases, and through this forum, I would like to request all to incorporate the Ayurveda lifestyle in all Ayurveda school and college curriculum to propagate education to all global population for their health and well-being. Thank you, sir.
Thank you. Thank you very much. And I request all of Ayurvedic doctors annually, at least every individual, at least conduct 12 Zoom meetings, monthly one Zoom meeting, and conducting and able to connect with all the practitioners in your database, inviting them to speak. You can decide your time and date and everything, whatever every month, January, month 1st or 2nd, 3rd, whatever the day you are doing, when you are doing empowering of the other Ayurveda doctors and other people, how you are allowing them to speak, and every person like that, that way you will learn more and more and conducting this type of Zoom meetings. Now next, our Kailash Nath Gupta ji, Dr. Kailash Nath Gupta ji. Unmute yourself. Kailash Nath Gupta. Next, Dr. Manisha Khatri. Dr. Manisha Khatri.
Hello. Namaskar, sir.
Namaste.
Myself, Dr. Manisha Khatri. I am from Haryana, sir, and I am from Shri Krishna Ayush University. So, I would like to tell more about my university, sir, that we are running, apart from Ayurveda, we are running naturopathy, yoga, and homeopathy in our premises. And our Vice Chancellor, Dr. K.S. Dhiman, sir, he is very much up to the upliftment of Ayurveda. Sir, we have weekly seminars, apart from research work, from each branch of Ayurveda for the upliftment of this Ayurveda course. And sir, for clinically also, we are developing the manual Nadi Pariksha seminars, and the clinicians are doing manual Nadi Pariksha, and we are also doing Prakriti assessments of the patients and the students also, because we have the college also. So we are teaching the students also the Prakriti assessment, and recently the government has also introduced the Prakriti assessment cards, and they have developed this one, like the Aadhaar card, they have developed the Prakriti assessment card. They have developed an app along with the CSIR IGIB, that every individual in India will have this Prakriti assessment card. So we are very much up to this also. And some challenges which I face are that there should be some standardization of our Ayurveda medicines, which is lacking. So, and there should be more cultivation of Ayurveda medicines. I'm facing this challenge because this is not very near to Delhi. It is approximately 200 kilometers from Delhi, and we don't. Many of the MRs of Ayurvedic pharmacies, they don't approach us. It's not that remote, but still they don't approach us. We don't get very good pharmacy medicines over here. This is what I think. And then one more thing is lacking. I think that there are less clinical trials which are done. We have our sir has developed it into a research institute, but still more clinical trials are needed so as to develop Ayurveda into a personalized medicine. That I feel, sir. Thank you, sir.
Thank you very much. And by the way, Dr. Kartar Singh Dhiman is my classmate, my batchmate. So we studied together at Gujarat Ayurveda University from 1988 to 1991. We both are batchmates of Dr. Kartar Singh.
Must be very much familiar about his mode of working, sir. And we are blessed that we have him as our vice chancellor.
Yes, very dedicated personality and everything. Very astute personality, very nice personality and everything. I know him very well. And now, and for that, the medicinal plants growing, it's not going to grow on the anywhere. In the rural areas, you have to go, and you have to empower the farmers to grow the dedicated way. That farmers, you have to contact them, give them something, that ashwagandha to go, tulsi to grow, this type of things. You have to empower them to go, and after growing there, you will be buying those, guaranteeing them that you buy these items from them. That way, the establishment takes place like that. Now, I will request Dr. Mauli Vaishnav. Dr. Mauli Vaishnav. Next, Patrice Williams. Patrice Williams.
Namaste, everyone.
Namaste.
Thank you all for being here today. I'm very excited. I'm actually very somewhat new to Ayurveda. I've heard about it. I've read about it.
So you are unmuted, Patrice.
Sorry, I'm actually looking. I've heard about Ayurveda through studies. Good. But I'm actually here today because I want to learn. I'm in the USA. I'm planning to take the first class in Ayurveda
Good.
from the Hindu University of America.
That's wonderful. You can connect with us, and you can send an email to us. We'll be happy to explain you more and more research-oriented information. Is there? I am living in Pennsylvania, in USA. I'm a citizen of America, and we can train you and educate you more. Next, Dr. Victoria Lohaste from Netherlands. Dr. Victoria?
Yes, hello.
Hello. Welcome.
It's a joy to be connected to this conference.
Yes.
So I will need a few minutes to set up my presentation. So can I just speak just in 5 minutes?
Yeah, you can speak the empowering of Ayurveda doctors, because we know that you studied from the Maharishi Ayurveda and
yes.
From the Iowa, and definitely you can give how Ayurveda you can be incorporated into the modern society and everything, empowering the Ayurveda doctors. Just only 2 minutes you can talk, because there are plenty of speakers are there. Just talk about 2 minutes.
So I was conducting the research on Maharishi Ayurveda toxification procedures. on overall mental and physical health, and we had good results. So overall results, we had 55% of decrease of anxiety, 42% of decrease in depression, 32 decrease in physical symptoms, and 20% decrease of fatigue and 2% of decrease in weight management, so the loss of weight.
Wonderful. That Victoria, what you can do, you can publish an article, send it to us. We will be happy to display all the Ayurveda doctors, how well you are doing and how you are doing research-oriented presentations like that. That will be good. If you're able to send it to us via email, your article, and we'll be happy to share with the people. Okay?
Wonderful. Thank you so much.
Dr. Vinita Kurup. Vinita Kurup. Dr. Vinita Kurup, next.
Yes, sir. I'm in.
Yeah, go ahead.
Hope you can hear me, sir.
Yeah.
First of all, a very happy birthday to you.
Thank you.
And I wish all the speakers and even the listeners to this great event. I cherish this event. Sir, I'm working as an associate professor from the Department of Samhita and Siddhanta, and I'm from JS Ayurveda Mahavidyalaya, Nadiyad, Gujarat, very near to Jamnagar. I hope you may be knowing the institute. It is one of the oldest institute of Ayurveda which is there in Gujarat. And I am being here since last 8 years. And we are doing a nice job here, sir. Like we have a specialty clinics or the hospitals exclusively running for the 2 chronic diseases, chronic kidney disease and chronic liver diseases. And Nadiyad city is famous with the name of our institute. And we have what to say, we have a success story of more than 30 years for treating especially these 2 conditions. And we have published many articles related to these 2. And I hope, I wish all of you to have a look on our institute to be a part in the healthcare research.
Thank you.
And I wish all a very happy days.
Thank you. Thank you, Vinita, Dr. Vinita, for giving these things. So we are advising for the Ayush Ministry also that every university, every colleges in MD Ayurveda, MS Ayurveda, PhD Ayurveda, everybody has to write a dissertation work, mandatory for the dissertation work to complete their studies. So what's happening there, every institution, every graduate, what is the thing, they are taking the topic according to their professors' interest, and they give the topic for them. Okay, for example, Marichadi Thailam for the Kandu Roga or the Kushta Roga. So when you are doing in each and every Ayurveda doctor, MD or PhD student, scholar doing the research, he may be able to get the skin disease conditions only 10 cases or 20 cases only in his institution, not many cases. So then he will publish a book and a thesis. He passed the examination and everything done. That is not validated by the Western countries because the number of patients needed to be 1,000 patients, 5,000 patients, 50,000 patients. So what is the thing is that we are giving a suggestion for the Ayush Ministry. All Ayurvedic colleges, MD students are there, MS students are there, PhD students are there. They have to take similar topics in various states. And what they do, for example, Marichadi Thailam is given for the Kandu Roga or Kushta Roga, and that can be done in Nadiyad as well as in Gujarat, as well as in the Karnataka or in Kerala. Various scholars are taking this. All the database has to be pulled together. They can have a Zoom meeting together. What they are doing, the Ayush Ministry is manufacturing one medicine and sending to all the medicine. There is no discrepancy of the medicine. It is distributed to all the places of the research-oriented places. Multi-centric research work. All the database has been collected and published.
Wonderful, wonderful.
That way, it is what's happening. then evidence-based Ayurveda to be established means, anything, for example, any Western medicine, when they are research work they are doing some from Kenya, Ireland, England, Germany, France, all the various countries, the multi-center location they will see, and they will study on the 200,000 patients. 200,000 patients, 2 lakhs patients they study. And whereas in our studies, Ayurveda studies are accepted only 10 patients, 20 cases, or case report, 1 case report, like that. It is not valid for the evidence-based medicine. There is no confidence will not develop. CCRA is doing some research work like that. So this is the way our BAMS, MD Ayurveda, MS Ayurveda graduates who are completing that way, they have to do a lot of research work and publications, and the Ayush Ministry has to protocol, put them together. Thank you very much. Next one is Dr. Dija. Dr. Dija.
Yes, sir.
Go ahead.
Sir, very good evening, sir. Once I just wish you very happy birthday to you. Like Dr. Vinita told, I also working in the same institute, JS Ayurveda Mahavidyalaya, as a professor in the Department of Samhita and Siddhanta, sir. I am basically from Kerala and now working in Gujarat since 5 years, sir. And she already introduced about our college. One of the best practice we are following here is daily practice of yajna or havan, which is explained in the Devapasri Chikitsa of Ayurveda. And our college is getting the good effects of that practice also. So I just wanted to advise all the upcoming doctors to incorporate this practice of Devapasri Chikitsa, like mantra chanting and all, in their practice also, so that they can, means along with the Devapasri Chikitsa and Sattva Chikitsa, so that they can also get the benefits of that. And now I wish all listeners and all guest speakers a good, happy day. Thank you, sir.
Thank you. Thank you. Next, Dr. Bijoyan Kumar. Bijoyan Kumar from Bhaumik. Dr. Bijoyan. Okay, he is traveling. He cannot speak. Next one is Dr. Satya Prakash Gupta. Yes.
नमस्ते।
नमस्ते।
भगवान धन्वंतरि जी को प्रणाम करते हुए I am chanting श्लोका रागादि रोगा सहजा समूला ये नासु सर्वे जगतोप्यपास्ता तमेक वैद्यम शीर्षा नमामि वैद्यागम ज्ञानश्च पिता महादीन। जिसने अपने एवं समस्त संसार के राग आदि रोगों को जड़ से दूर भगा दिया, उस एकमात्र वैद्य तथा वेत्ता ब्रह्मा आदि को सिर नवाकर प्रणाम करता हूँ। थैंक्स फॉर इनवाइटिंग मी। आयुर्वेद का टॉपिक है आई एम गुरु इन राष्ट्रीय आयुर्वेद विद्यापीठ, नेशनल एकेडमी ऑफ आयुर्वेदा, इन आयुष मिनिस्ट्री, गवर्नमेंट ऑफ इंडिया, एंड आई एम प्रैक्टिसिंग विद सेल्फ प्रिपेयर्ड आयुर्वेदिक मेडिसिन। मोस्टली आई एम डीलिंग with the chronic cases. In India, cases usually comes to us, especially in UP in Muradabad, comes to us with the bundle of diseases. उसको उभयार्थकारी कहा गया है, coexistence of multiple diseases. We see in our daily practice that a patient comes to us with a multiple diseases known as syndrome cases. If a patient of diabetes suffering from peripheral neuropathy, hypertension, abdominal obesity, fatty liver, and so on, skin ailments, then we have to find out the dominant dosh, anubandh hai, cardinal humor, मुख्य दोष कौन सा है, which is the cardinal humor in the patient. Today we cannot treat, we should not treat the patient on the disease basis only. We have to assess in these patients suffering from multiple diseases what is the cardinal humor, and the cardinal humor involvement, if we find that cough involvement is there, cough is dominant is there, it is due to arm. One word in our Ayurveda we repeatedly use with my students coming from Ayush Ministry, National Academy of Ayurveda. Arm, what is known as arm? This arm is known as in the contemporary period as a histamine, as antigens, as toxins, noxious substances, free radicals, and so on. So free radicals, antigens and histamines and noxious substances, you may say arm. This arm is the causative agent for various diseases. Today in our daily practice, in my daily clinical practice, we see that a patient is coming from resistance of the medicines, hypertension is not responding to the medicines given by the other doctors. I am not taking the name of those pathies. Now somebody said that 42% of the patients suffer from hypertension despite medication. It is not in Ayurveda. We are dealing with so many diseases that resistance is why resistance is developing in these cases because of the arm collection. In one word is used, Sukta Pak, minute toxic form of arm has entered into the channels. This is due to the Kaph Vruddhi. So we have to assess the Prakriti and Vikriti in the patient you are treating. If the Prakriti of patient is Kaph and Vikriti is Kaph, then you may you may treat the patient accordingly. Bhallatak is the very good medicine to expel out these toxins from the channels. DVT, deep vein thrombosis. Now the cases are coming with the coronary artery blockade. A word we have seen, we know that metabolic syndrome is floating in the society very much. Cases of metabolic syndrome means insulin resistance diabetes mellitus. Insulin is not functioning properly in the diabetes cases of the type 2. Why? It is due to collection of arm in the small channels. Why the insulin, why the medicine of diabetes is not responding to the DMT2 cases? Why this arm is only responsible? Why? Because this arm has caused the thickening of the cell membrane, and this thickening of the cell membrane has blocked the penetration power of the insulin to enter into the cell membrane, so that the sugar remains undigested. Now we Ayurvedic people need to pay attention toward the arm collection in the cell membrane. This is
Thank you, Dr. Satyaprakash ji. What you needed to do here, it's a very limited time for all the other speakers to speak. Okay, we have limited.
We do Sanshodhan and Sanshaman, pacification therapy. Now purification therapy is not needed due to the Shukta Pak. Pacification therapy we cannot treat these cases.
Thank you. What you do, Satyaprakash ji, you write an article and completely your thought processes and everything, please send it to us. We review it and we will post it on the website and we'll circulate to all the people. That way they can understand the concept of the healing and everything, how the new concepts are bringing up the ama, how to ama detoxification can be done. Thank you. Next speaker, Dr. Arati. Dr. Arati Hariharan.
Good evening, sir. Good evening, sir. Myself, Dr. Aarti Hariharan. I am working as an assistant professor in JS Ayurveda Mahavidyalaya. First of all, I would like to thank AAPNA Foundation and Dr. Shekhar Annambotla, sir, for giving me an opportunity. And I wish a very happy birthday to you, sir. As my colleagues have already spoken about our institute, JS Ayurveda Mahavidyalaya, it is one of the prestigious institute in Gujarat and one of the oldest institute. And we are specialized in kidney disorders and liver disorders. And it is considered as a CCRS research center for kidney and liver disorders. And various research works as well as various projects are being carried out in our institute. And speaking about my area of practice, I am more into lifestyle disorders, and that too, I have a super specialty practice in hypothyroidism. And I'm incorporating Panchapautik Chikitsa in my practice. And I have got very successful results with this. Until now, I have treated more than 500 patients of hypothyroidism with this Panchapautik Chikitsa. And my area of focus is treating the gut and the Agni in patients. And I'm more focused towards the Ahara and as well as treating the gut microbiome. As in functional medicine in modern, mostly people are now more oriented towards this concept of gut microbiome. But in Ayurveda, as we can see, it is related to Koshta and Agni. So in my practice, I have got very good results in thyroid cases, and I have been able to stop the use of levothyroxine in many of my patients by incorporating this Panchapautik Chikitsa as well as focusing on the gut of the patients. So that is a unique way of practice which I have incorporated. And I would like to thank Ayurveda for this. And once again, thank you, sir.
Glad to know that your institute is conducting the kidney and liver disorders and everything. And that's the thing. I request your dean to establish Ayurveda Kidney Journal. AKJ, that means Ayurveda Kidney Journal, Ayurveda Liver Journal. to start
Okay, sir.
two journals, editorial board,
Yes.
everything, research-oriented papers to be published and everything. And either it can
Okay,
be
sir.
online program or the physical copies like that can be prepared. AKJ, ALJ, two journals can be
Okay.
put that way, and they can establish and publish the articles and everything, and the videos
Yes,
and
sir.
all the different things can be done. Thank you very much. Next,
Sure, sir. Thank you so much, sir.
next, Bhami Vora. Bhami Vora. Dr. Ankur B. Dr. Ankur B. Singh. Narayan Prakash. So I think all of them finished. The majority people are speakers are finished. Some of the people drop out and everything. So if anybody missing from this group would like to share, and we will be concluding this session exactly 1 hour time. We are concluding this session. And Akhil Babu, to everyone, I would like to share. Please, Akhil Babu.
Yes, sir.
Yeah, go ahead.
Good evening. Namaste to everyone. I'm Dr. Akhil Babuti, Assistant Professor in Rachanashari Department of Noble Ayurveda College, Gujarat. So, sir, actually, I was here to just quote one thing that even in this day, Ayurveda, I feel after studying this much of years, I feel like even 1% of the Ayurveda is not being explored, like reading it in between the lines. Can I quote one example that is about heart's little brain, which is a very good researchers are explaining this topic very much these days. They are saying heart has its own intrinsic nervous system, like 40,000 neurons. So they are explaining every mental health issue should be focused on heart-based things, right? But look into the Ayurvedic lines. Heart is the Chetana Sthana, it is the Mano Srotas Mula, it is the Sthana of Atma, it is the Sthana of Ojas. So all these have already been explained in Ayurveda in a different way. So I just personally want all the institutions to properly focus on all the lines of the Ayurvedic and let the students who are upcoming, let them learn pure Ayurveda, reading it between the lines, thinking their own way, so that we can have a good Ayurvedic practice. Hope this will happen one day. Thank you so much. Only this much I have to share.
Thank you. Thank you very much. And anybody would like to speak? And then we conclude the session, today's session. Mauli, you want to talk? Dr. Mauli?
Yes, sir.
Yeah, go ahead.
First of all, wish you a very happy birthday, sir. And I am very grateful to provide me this opportunity. I'm working as associate professor at Swaminarayan University, Gandhinagar, Gujarat. So, sir, here I would like to focus on one area because other all area has been already covered. So recently, I am talking with some of my allopathic friends. So usually, first of all, question is from them is after Ayurvedic medicine, patients are by getting some liver disorders or kidney disorders, etc. So here I would like to focus on the safety area of the Ayurvedic medicine. Usually, some patients we have already observed that they are taking already medicine has been prescribed for a shorter period, but they are taking up to 1 year, 2 year, like Rasaushadis. And because of that, many of the patients have this liver damage, kidney damage, kind of the problem. So first of all, we have to make awareness with public as well as our students also who are prescribing the medication. They must strictly tell them patient that the period should be strictly followed, as we are using personalized approach in the Ayurveda, and each and every patient should be provided a specific medicine according to Dashvit Pariksha Bhav, Dashvit Pariksha, and proper dose, etc. We are deciding. So how the medicine should be taken, that should be given awareness to the public.
Good, very good. Thank you for this. What we are trying to do with the Ayush Ministry, we are already informing to them that what is the thing is that like a Western medicine, you cannot buy antibiotics about people when the prescription of antibiotic is given only for weekdays or 10 days can be given. Then under the supervision of the physician, it is prescribed and is the only duration of taken like that. Similar way, in America also, whenever the antibiotic is given, for example, Mauli is prescribing Samira Pannagras to the one of the patient. For example, in the prescription itself, in the bottle itself, it has to be clearly written that who is the prescriber, who is the patient, how long he is taking, that's it. After that, the dispensing, the pharmacist should not give more than 7 days or 10 days or 3 months supply. Other than that, they cannot get it. That restriction has to be established like that. There are OTC products like Triphala, Tulasi tablets, Karela tablets. Those type of things can be taken. Whereas Rasaushadhas, particularly anything Schedule H drugs or specific drugs, we have to be a Rasashastra department people has to identify these medications, has to be categorized and put them into the custody like that in such a way that has to be prescription oriented only. That means not in public. If anybody goes there, I wanted to purchase Brudva Chintamani or Triloki Chintamani or Hemagarbha Potali. They cannot buy anything without the prescription of the physician, and the individual patient's name has to be given, how many days he has to take, everything is restricted. Then it will be very successful, and then every lab has to be tested for every medicine and heavy metal contents and everything. That is the biggest problem in the world now. The West Ayurvedic medicines having heavy metal contents are there. That is the reason we are having a difficulty of absorbing all the heavy metal content, because in the ancient time, the Vaidyas preparing with the large, small quantity of preparations in a way that all the samskaras they are doing. Now, in a short period of time, people are manufacturing shortcuts. They are doing. Pharmacies are manufacturing such a good, not good quality products are there. People are unnecessarily using. That is the reason it's very important that some companies that manufacture very good, very well products are there that has to be tested, ISI marked properly and given properly, and restriction is required. Otherwise, the bad name will come. If the medicine is bad, it gives a bad name to the system, and physicians are bad, then also gives the system, overall system is affected in everywhere, and it spread to all the area. That we are educated people, we need to empower, we have to work on that and giving these things that any prescription, like one patient, she asked that in America, one of the pregnant ladies, she asked that, can I take Simhanath Gugulu tablets? I said that who prescribed it to you? My grandmother used to take it. So grandmother is not pregnant. You are pregnant. Yes. You know that if you take this Simhanath Gugulu, which is having a castor oil is there, you will get abortion. You will kill the baby. Really? So this is the thing is very important that it should not be prescribed. Your husband got antibiotic. Do you take the antibiotic? No. Your daughter got antibiotic. You take the antibiotic? No. Similar way, Ayurvedic medicine should be properly prescribed and individually has to be taken. That documentation has to be taken, how long they are taking. This is wonderful. Thank you very much. All the Ayurveda doctors who are joined with us and working with us, and contraindications and complications and everything has to be documented and everything. Thank you one and all. Again, next year we'll join October 3rd, third Global Ayurveda Doctors Day. This is the GADD, G-A-D-D. That means Global Ayurveda Doctors Day, G-A-D-D, GADD. Okay. Thank you very much. Namaste to all.